This is the Berman Method Podcast featuring Dr. Jake Berman and physician assistant Jenni Berman. We are here to treat problems and not symptoms. Disclaimer, this podcast is for entertainment purposes only and not to treat anyone or to give medical advice. If you are interested in any information that we are giving and would like to use this for yourself, we recommend that you contact your primary care physician or reach out to us and ask us questions about yourself specifically. Enjoy. Welcome to the Berman Method Podcast, where we are focused on treating problems and not symptoms. I am Jenni Berman, physician assistant. Jake is not with us today. Dr. Jake Berman is not here. However, I do have a very, very special guest on the podcast, which I am really excited to share with you guys. I am going to announce her and let you know who she is, and then I will tell you how I got this superstar on our podcast, and how I'm so dearly connected to her and thankful for her. Dr. Carolyn Cederquist is here. Thank you, Dr. Cederquist, for joining us today.
Oh, thank you, Jenni.
Dr. Carolyn Cederquist attended the University of Miami's honors program in medical education, and this allowed her to finish her bachelor's and MD degree in just 6 years. So she got her bachelor's degree and her medical doctor degree all in 6 years. Superstar fact number one about her. Following graduation, Dr. Cederquist's clinical work with patients of all ages gave her a comprehensive view of Americans' health issues, and she observed that too many of the problems faced by her patients were directly related to nutrition and weight loss issues. She remains one of only about 850 physicians in the nation to have achieved board certification in the field of obesity medicine. She became board certified by the Institute of Functional Medicine as well in 2018. In 1998, Dr. Cederquist founded the Cederquist Medical Wellness Center in Naples, Florida. Dr. Cederquist is also the Chief Medical Officer of Bistro MD, of the company that she co-founded with her husband in 2005, which is a meal delivery service and weight loss food program all across the United States. Dr. Cederquist lectures nationally and internationally for medical professionals and the lay public about functional medicine and the entire complex of causes and consequences related to Americans and their weight issues. She published her first book in 2002, which earned national attention for its clarity, and her second book, which is called The MD Factor, was published in 2015. Dr. Cederquist has also been a paid consultant for Pure Encapsulation since 2011, which is the supplement company that we actually utilize most often in our office for our clients as well. And I am super happy to announce that Dr. Cederquist has been a mentor of mine for about 8 years now, where I was grateful enough to work with her at the Cederquist Medical and Wellness Center for several years. And she actually has helped me in more ways than I can even count with my own health history, with my fertility, infertility history, and now even with our children that we have today. So I am so happy to have her as a mentor just in general in life, but also to have her on the podcast today. So thank you again for joining us.
Oh, well, thank you, Jenni. It really is an honor to be here.
So just a little background, I started working with Dr. Cederquist as I was going through my own health issues as far as food sensitivities. And after I had already figured out the gluten issue and was starting to heal my own gut, but she was the one that actually taught me about food sensitivity testing and IgG testing and gut healing. So that's just a kind of a side fact of all of her knowledge. But today I would like to talk a little bit more about the obesity side of things with your journey through the books that you've written and the knowledge base that you have in obesity medicine, since that's one of your specialties.
Yeah, for sure. So I did my residency in family medicine, and in family medicine, you treat everyone of all ages. You deliver babies, you treat the elderly, and everybody in between. And it really became clear early on that so many things that were going on with people, blood pressure, diabetes, even certain types of cancers, had a factor with regards to having an unhealthy weight. And when I would bring this up with some of my patients, no one ever said, oh, I like being 30, 50 pounds overweight. I want to stay here. No one ever said that. Right. They said, I get it. I've tried to lose weight. I understand the health implications. I just find that I can't, or that if I lose weight, I seem to gain it back so fast. It's become such a spiral for me that I've given up trying, or other times, like I'm actively trying to lose weight and I haven't lost any, so it really became a quest for me to understand this better and help my patients more. And it wasn't something that was really easy to do in a traditional family practice, traditional medicine setting, because you have 15-minute office visits. So someone will come in with high blood pressure or borderline blood sugar or elevated cholesterol. There isn't time to discuss what's going on with you, with your diet, your lifestyle, emotional stressors, your sleep. There's no time for any of that. Right. The best we could do is like get somebody on some blood pressure medicine and maybe start something for blood sugar, have them come back for lab work. And honestly, that felt very unsatisfying.
Well, absolutely. And we talk about that all the time to our listeners, is that, the point in primary care is that we're not killing our patients, right? We just want them to live. And so we write that blood pressure prescription because that's what we have time to do in those short visits. And so that's kind of what led you into doing something different, opening up your own practice where you had a little bit more time, or a lot of bit more time, to be able to spend with your clients and really dig deeper into what is actually causing the weight gain. We hear all the time, well, it's my genetics. My parents are obese and I've tried everything and it just is what it is. But that's not always the case.
Yeah, for sure. And we know that, human genetics hasn't really changed in the past 50 years, but that's where we really have seen this huge uptake in weight issues. And, part of it is like processed foods and all these other things as well. But, many times people will use the genetics thing as like, everyone in my family is overweight, so this is how it is for me. Like nothing I do will make a difference. And we definitely know that's not true. At one point, probably about 10, 15 years ago, we decided to do some genetic single nucleotide polymorphism testing. These are looking for specific patterns in the DNA that are present in certain people that would predispose them to certain things, being likely to feel less full, being more likely to put weight on, being more likely to regain after losing, different things that would come up with this list saying, what percentage of these genes do you have? And our thought was maybe we could uncover some specific things that we could use to help individual patients. What I didn't find that to be all that helpful, to be honest. Like, the patients that we tested were ones where we had tried lots of things and maybe a bunch of things didn't really work too well. But I decided to test myself and found that I had like the highest level of these obesity genes that they were testing for. Oh, wow. And it was like, whoa. And I remember I tested this other patient who was like this gentleman, and he was like 305 pounds, and he came in the lowest percentage of these genes. Mm-hmm. So clearly we have not identified all the genes. But, if I look at myself, both of my parents were overweight, pretty much my entire, family has struggled with weight or is overweight. And it's probably one of the reasons that I was very interested in learning more, because even in rudimentary beginnings of medical school, they said if two parents are overweight, you're 80% likely to be overweight. It's a pretty high number. Is it nurture? Is it the genetics? The bottom line is it's a combination of both. But early on, I determined, I was going to exercise more regularly. I was going to try to figure out what's going on with my own blood sugar balance and different things, learning how my body responds to food. And I've been able to maintain a healthy weight for my entire adult life, despite having those higher obesity genes.
Sure.
And when I think
having
back
4
on
children, by the way.
Yes, 4 children, yes, and I remember being especially careful in pregnancy, because it was like, it's so easy. So many women gain sometimes 50, 60 pounds and never lose it. It's a time of significant change for many people. But it really was something that I look back on, is if I had known I had that super high percent of obesity genes, that may not have been good for me. Sure. I may have been like, oh, well, I can't fight my genetics, why go to the gym? Why does it matter? Blah, blah, blah. But in reality, that wasn't the case. Our genes are not the 100% answer with everything. There definitely is the ability to turn on certain genes and turn off certain genes. And the things that come down to healthy lifestyle, like regular physical exercise, avoiding processed foods, all the things that you hear that you should do, play a significant role in making these genes turn on or turn off. So there's a lot of power in that.
Yes. And we love that. I love, talking about that and just showing patients that your genetics aren't going to make you up, or they don't have to make you up. They can. And just like you said, you could have seen the results of your genetic testing and said, well, it is what it is. That's how it's going to be. I should just not even try. But you are living proof that we have the ability to turn these genes on and off with our outside factors of the exercise, the right foods going into our body, the processed foods. And so speaking of that, something we talk about frequently is we have to find the right makeup of food for our body specifically, because your genes and my genes are different. The nutrients you need are different than the nutrients I need. And that goes for most individuals.
For sure. So another thing with this, like genetic testing, again, like in our practice, we experimented with it like fairly briefly, like maybe over a period of a year or two. And it was primarily that it wasn't this like, aha, we figured it out. There certainly are some like commercial weight loss centers that there's a lot of advertising about this. Like, we know what kind of diet or meal plan you're going to need based on your genetics. But what we actually found is that you could, for every person, you can look at their blood work and see what's happening in their body now. So the fact that they have a predisposition to develop pre-diabetes, well, that's interesting. But what is their blood sugar doing now? And if somebody has genes that theoretically don't put them at a predisposition to pre-diabetes, but lo and behold, their blood sugar is elevated, or their 3-month blood sugar marker, the glycohemoglobin, is elevated, indeed they have it. It doesn't matter that these genes that we're able to pull out and show don't show it.
Right.
Clearly, it's so much more complicated than that. And what I found mattered is what's going on now in your body. And it doesn't mean that's going to happen forever. Just because your blood sugar is elevated now, you change your diet, you change your exercise, you change maybe some supplementation with something you're low in, that can get better. So I find, and that certainly you have seen in your practice, that looking at people's labs now makes so much more difference than what they potentially have a genetic predisposition to.
Right. And it changes quickly. We'll have clients come into our office and be like, well, I had lab work done last year. Can you use that? A lot can change in a year, just like we can change a lot of things moving forward in the next 3 or 6 months, where we should recheck your blood work and reevaluate your nutrients and your supplementation. And if you have certain macronutrients, meaning your proteins, carbs, and fats now based on your labs, and we start you on certain supplements now, you may not need those 3 months from now when we've gotten you on a more steady nutrient plan and exercise regimen. So the genetics or the genes that we're turning on and off can happen pretty quickly as well.
Absolutely. And the improvements in lab work, we saw all the time can happen very, very quickly. I mean,
Right.
sometimes it takes longer depending upon what is happening with that individual patient. But sometimes within 6 weeks or 12 weeks, so, 3 months, dramatic improvements in blood sugar, cholesterol, blood pressure, all of these markers that are looking at your, what we would call cardiometabolic health.
Right. Absolutely. So what do you think is necessary for a person to have success in lifelong weight management? You've already mentioned that through your whole adult life, having 4 children, a lot of stress, owning a business, selling a business, you've been able to maintain your weight with having the genetic predisposition. So what do you think is the most important factor for our listeners that are either in the process of losing weight and want to maintain it or are still struggling?
Yes. So a couple things. I mean, I definitely think figuring out what's going on with you, and hopefully if somebody has access to somebody like you who can look at labs and give very specific recommendations, that would be ideal. Unfortunately, not everybody has that ability. But what we have to realize is that, what may work for one person may not work for somebody else. So you have to try certain things on and give it long enough to see if it will help. So many times there's like, oh, I want to lose weight, and after 4 days, oh, I didn't lose weight. People are willing to give all that up. Unfortunately, it takes longer than that. So you have to give things a little bit longer trial. But once you find what seems to be working for your body in terms of you're feeling you have energy, you feel like that you're able to gradually increase your exercise and take on more, then you have to find it a way for these health promoting strategies to become habits.
Right.
So habits are things that we do without really thinking about them.
Right.
Now, most of the time people think about bad habits, like people who smoke, that's a bad habit, or biting your nails, it's a bad habit. But getting up in the morning to exercise is a habit. Going ahead and having a glass of water 30 minutes before mealtime, because that helps you feel a little bit more full, is a habit. Plating your food on a smaller plate so it feels like it's more full, or taking longer to chew. These different simple things are indeed habits.
Right.
And what I found so helpful is when, I was working, full time, or let's say over full time, and 4 kids at home and all that. The only time that I could actually exercise was at 5:30 in the morning, because other than that, I'm at work, and then there's after school stuff, and then there's homework, and there's things to proofread for the kids, there's housework, there's everything,
Right.
And well, I would set my alarm for 5. And at 5 o'clock in the morning, there's no time to have a conversation with yourself.
Right.
It's kind of one of the things I liked about it. You can be like, oh, should I get up? Shouldn't I get up? Maybe if I don't go today, I could go tomorrow. Like all this bargaining and stuff. And it's like, no time for that, not having to have a conversation with yourself because it's a habit. And not necessarily just the 5 o'clock, you set up your schedule. I'm a big fan of scheduling. I think that's a good habit where it's like, okay, so on Tuesday, I do kickboxing, or I do this or that. You schedule your life, and you include important things like movement and exercise in it, or even just for your own mental well-being, which is a huge part of this whole stress response that gets kicked in if you have no way to modulate it, that affects your weight.
Right.
But it becomes in your schedule, and then you don't talk yourself out of it. That really is key. And it can take sometimes a while for those things to become a habit within your life. But they're definitely really powerful when they're there. Right. Because again, it takes all that decision making out of it.
Absolutely. And, putting it like you schedule a meeting, right? You schedule meetings for work. You don't like to go to every single meeting that's on your schedule, but you do it because we have to. And so same thing with our exercise. you will start to like exercise. You may not love it at first, but just scheduling it in your calendar so you're accountable to that. Same thing with getting your snacks in. Set alarm on your phones to remind you to get your snack every couple of hours, between breakfast and lunch and between lunch and dinner, because that's going to help with the long-term effects of your weight management. So set the alarms on your phones, put it into your calendar, utilize tools that are going to create these habits. So then it's mindless at that point. And like you said, initially the first 2 weeks of waking up at 5 a.m. is very challenging. But if we make it a commitment and hold ourselves accountable to that, then our body craves that wake up time and movement time and the adrenaline that we get from that early morning exercise.
Absolutely. And I think, as you said, mindless, getting these health promoting things into a mindless place is actually really, really helpful. Just as so many people also experience that they get to mindless eating or mindless TV watching or mindless scrolling on the phone. It's very easy for these things that we don't intend to overtake our lives, but it's so easy for them to do that, and then all of a sudden you're not moving, you have no idea really what you've eaten because you ate it mindlessly, and all those other things. So trying to replace those with things that are habits that work for you, that work towards creating and maintaining a healthy weight and lifestyle is really the key.
Absolutely. Absolutely. And utilizing the tools that you can to create those habits. I'm going through it right now. I've announced on a podcast a couple of weeks ago that we're working through some eating with Stella, and they recommended for me to weigh all of her food and track all of her food. And at the end of the day, I'll be like, oh, I haven't tracked anything. And so again, it's new for me. I don't, at this point in my life, have to track my own food because I'm very familiar with what my body needs as I've created a habit out of it. But so I'm not in the habit currently of tracking Stella's food. And it's something that I've now had to put a reminder in my phone that says, track Stella's food. And eventually, after probably 21 days of that coming up on my phone, I won't have to look at it anymore. And it will now be a habit of mine to do that. So I understand, with our clients, we're implementing so many different changes and trying to create different habits along the way, but it's just a matter of having someone to help guide you, to hold you accountable, having your calendar there, having us there. The weekly meetings with individuals can be really helpful. And that was something that you implemented in your practice to help with the weight management, was seeing the clients on a weekly basis to help hold them accountable to these habits that we were trying to create for them.
Absolutely. The weekly meetings were really, really helpful. And it was something that really, isn't done so much in traditional medicine just because there's not enough time and in people's schedule. But we went ahead and we had dietitians who would see our patients weekly. And, it made a difference in so many ways, not just holding people to account to something, but sometimes you can try something for a week or two. And the honest truth is it doesn't work for you.
Right.
So instead of just like giving it up completely, to be able to readjust it or make some kind of pivot into something that actually is more effective versus again, stopping the activity altogether. We don't always know right from the very first time we meet somebody that, what's going to work for them. It really is a period of trying things on, trial and success, we'll say, instead of trial and error. Right. But we don't know. Everyone's really unique.
Right. And I love that you brought that up. That's a conversation I had just a couple days ago with a client who's now 2 weeks into the program and has been struggling to see weight loss on the scale. And I was like, okay, well, that means we have to change something. So we're not doing something right, or we're not doing it perfect yet, which we don't expect. It's only been 2 weeks. But something outside of that is, with a metabolic condition called insulin resistance, which I know listeners have heard me say that in the past, where the body is not metabolizing efficiently, the movement on the scale can actually take a little bit longer than the inches that we're seeing in our, in the waistline or in our clothing. And so clients will, if we weren't seeing her weekly, she would have gotten very frustrated at 2 weeks in and said, this isn't working, and had given up. However, we were able to, one, assess what she had been doing and make some recommendations and changes, but two, talk a little bit more in depth about insulin resistance and the fact that it does take a little bit longer to see the scale start moving. But then, you're already noticing changes in your energy and in your sleep. You're taking half of the melatonin you were when you first started here and are able to sleep through the night. So reminding her of those positives and knowing you're doing something right. And the metabolic side of it, of the weight, is going to come as long as we're staying encouraged and staying consistent.
Right. Absolutely.
So, and the next week she saw a pound weight loss. So it was, it just used that to really motivate people as far as the weekly, and like we said, the accountability. I want to kind of turn the conversation a little bit, because you've done a lot of research on the postmenopausal woman, and I'm sure you heard it a lot in your practice where they came in and they said, I just really need hormone replacement. I have all these symptoms of menopause. I need hormone replacement. What is your take on your book of the MD factor and what you found with insulin resistance and being able to help postmenopausal women without necessarily needing hormone replacement? Or did you find that hormone replacement was helpful?
Yeah, good question. So menopause does really change things. There's change in the sex hormone levels, the estrogen and progesterone, and there really is an increase in the metabolic syndrome or insulin resistance that occurs with that. In not just patients that we've seen, but basically in research studies looking over populations, that with menopause, there's this change. Estrogen is protective of that, prior to menopause. So women develop this pre-diabetic condition, this insulin resistance, more so with menopause. They can certainly have it earlier, but for many women, it can really kick in and take a hold then. And one of the consequences is, of course, weight gain, but also elevated blood sugar, changes in cholesterol. And so a natural thought would be, okay, let's put the hormones back. And what the research really shows is that doesn't necessarily make the difference. I am certainly not against hormone replacement therapy. I think that many women are really benefited by it, but some women do not benefit from it and probably have harms from it. It definitely is considered safe and worth the side effects if a woman is having a lot of symptoms of menopause, the hot flashes, the night sweats. But taking it solely to avoid gaining weight or to lose weight once somebody has gained weight, we haven't found that to be the case.
Okay.
And so what does it also do for women who say, don't have the ability to take hormone therapy at all,
Right.
such as they might have breast cancer or extremely strong family history of breast cancer, or they may have other clotting and cardiovascular issues where they cannot take hormone therapy. We would see these women in our practice, and we would see that they had developed insulin resistance. And we were able to treat that without using hormone replacement therapy because it was considered contraindicated. So I think, most women will experience some degree of insulin resistance as they go through the menopause transition. If they're looking out for it and make adjustments in their, diet and exercise in order to keep watch for it and keep it under control, it can be minimized. And certainly that's the meal plan that you're using for your patients who struggle with insulin resistance who aren't in menopause, more protein, but not a high fat diet, low carbohydrate, but again, not a high fat, low carbohydrate diet, can really make a huge difference in terms of minimizing these metabolic changes that do occur with menopause.
Right. Yes. And we've seen the same thing, that for the women who aren't able or maybe had adverse effect to using hormone replacement or just don't want to. They'll come in with hot flashes, fatigue, not being able to sleep at night. And really just with improving their overall blood sugar, improving their cortisol levels, and stabilizing their blood sugar through night, their menopause, quote unquote, I'm using air quotes right now, menopause symptoms of the hot flashes and the night sweats and the poor sleep actually improved just based off the supplementation and blood sugar stability, which is really amazing. Now, like you said, some women do need hormone replacement and it's necessary in some cases, but just being able to make a change with the diet is amazing.
Yeah, I started my practice in 1998. And then in 2002, so 4 years later, was this big study that came out that said that hormone therapy was harmful. And of course, it was some stuff lost in the translation, but basically a whole generation of women pretty much stopped taking hormone therapy. And many of them would come to my office and they had gained this weight and very concerned. But hormone therapy is this big evil and all of that. And the same thing I say now, I said then, it's like, if you feel you really need to take it, if you're having these horrible symptoms and nothing else helps, take it. Don't, make your informed decision. But we can try to see if we can improve some of these other things with lifestyle changes. And we had a huge amount of experience with that because we had so many women at that time who were just not wanting to continue hormone therapy if they had taken it before or start it. Right. And we definitely found that we could do it without. And I really think with hormone replacement, it's definitely a woman by woman thing. It really has to be, there's risks and there's benefits, and what are the risks for each individual woman. But I think there's a lot of things being sold, like if you take hormone therapy, you'll never age, and your skin will be amazing, and all these other things. And it's like, that's again overselling it. Right. We know it can do certain things, but you really have to look at all parts of it.
Right. And that kind of leads us into the new drugs that are out there for insulin resistance, since we're on that topic of blood sugar stability. And there's of course so much information now coming out on the media about these new drugs that can help with weight loss and helping with the total insulin resistance, although it's not being marketed for insulin resistance, really being marketed for weight loss. What is your thought process on these new drugs that are being blasted?
Okay. Well, thanks. It's a good question. In my practice, we primarily focused on lifestyle things, but we did use medicine sometimes. Right. So right now there's a tremendous increase in these meds, these new medicines, these injectable meds that make people less hungry and slows their stomach down, these medicines that were initially approved for diabetes. But there have been medicines that have been used for weight loss for years, including other types of appetite suppressants that work in the brain, and other medicines actually for blood sugar and for insulin resistance as well, like pills that we would certainly use in the practice. I find that all medicines for weight loss can be a tool, meaning that they're not going to be the cure for the weight issue, but they can be a tool as part of these other lifestyle things that people are doing and using along with it. And in that context, they can be additive. It can help people be less hungry, have less craving, stick to a healthier diet, maybe control blood sugar enough so that they're no longer having these spikes that drive hunger and that people are able to lose weight. What I think is very interesting is right from the get-go in the media, they're really talking about how these medicines are going to need to be taken lifelong. And it's a huge change. So in my practice in weight management, the older appetite suppressants were always kind of thought of as, okay, you can use them, but only for a short time. It's like, take these things to control your appetite, and then learn how to eat, learn portion sizes, get yourself under control and get off these things right away, as fast as you can, 3 months max, this type of thing. And for doctors who really specialized in obesity medicine, weight management would be like, well, We don't do this with blood pressure medicines. We don't tell people like, okay, we're getting you on blood pressure medicine and then change your lifestyle and do all this stuff. I mean, we do say that, eat less salt and all that.
Right.
But then after 3 months, you have to come off it.
Right.
Nobody would say that. They'd be like, if it's controlling your blood pressure, fine. And then over time, it was sort of like, here, take this blood pressure medicine and don't do anything else differently. When we know there's a huge component of lifestyle, which affects blood pressure. So in recent years, the medicines that have gotten approved for weight management have been approved for long-term use because we're dealing with this massive epidemic of obesity and weight problems. So they can no longer say that, oh, it's only like 10% of the population. Now you're more likely to be overweight than normal weight in this country. Like 70% of the country is officially overweight and medically overweight. So it's not a small number. So you can't just say, okay, yeah, you're an outlier. But it's just so interesting that these very, very expensive medicines are being, already talked up how you're going to have to take it forever. And, $1,000 or, a month or what some of these meds are. And initially people are getting them for $25 a month or something for the first year. But then after that, they're not going to get them at that cost anymore.
Right.
$1,000 a month sounds like a rent payment to me.
Yes.
Especially with insurance and things not covering it. But that being said, I'm not against those medicines, but I'm concerned that they're almost have this halo around them, as they are like the first thing that's ever worked and it's the only thing, and people are going to have to take these forever. Well, we don't have research of people taking these things 15 years and the consequences of that. And they're not the only medicines out there.
Right.
Some people could be benefited by taking some of the older medicines or even ones that have been more newly approved, like in the past 5 to 7 years, which also work for weight, and use those. It's not like these are the only things.
Right. I absolutely. And again, there's certain situations where they're necessary and beneficial. But like you said, there's other options. There's the dietary aspect of it that you still have to use and coincide with the medications that are being taken. And again, going back to where we first started this conversation is, what does your blood look like? Are you just walking into a walk-in clinic and being handed this medication without even assessing your insides, your blood testing, your meal plan, how your body is absorbing nutrients? All of that's going to play a role of how effective and safe the medication is for you too.
Right. And long-term use. I mean, that and long-term results. One of the concerns I have with the newer injectable medicines is that they are, for some people, very effective at abolishing appetite, and they slow the digestion through the stomach, which can cause like longer effects. But a lot of times when people aren't hungry, they just don't eat very well. It's not that they're just eating less, and that has been one of the biggest biases against real quality weight loss medicine treatment. When I say medicine, I mean management by people like you, with dietary and stuff like that. Because there's still this bias that everyone who's overweight is just eating too much.
Right.
They just eat too much. If they could just eat less, doesn't matter what part less or whatever, that they'll be fine. But if someone's not hungry and they end up eating, I'm just going to have like 4 grapes and I don't know, 3 crackers, 1 rice cake with a little peanut butter or whatever. Yeah, you'll lose weight, but you will also catabolize your lean muscle tissue. And that has catastrophic effects, not just on your metabolism, but on frailty. And there is concern that some of these medicines for weight loss, that people are losing a very high percent of lean body mass in the process. And that's going to have considerable effects as these people move forward.
Right.
So proper nutrition, along with the use of these medicines, has to be part and parcel of it. But because it's become easy, like somebody can get a prescription and maybe they're appropriately overweight, the amount overweight that they're having other issues, fine, they qualify for it. But are they just given a prescription and say, go at it?
Right.
You'll eat less, you'll be less hungry, but not realizing that, oh, my breakfast of like cornflakes or something is good, and my lunch of like rice cake and slice of cheese is a good lunch, that type of stuff. I'm concerned for that.
Right. Most definitely. And being able to maintain, like you've already said, maintain the muscle mass that we need to be able to continue to age appropriately, and being able to keep up with our daily activities. But also vitamin deficiencies. A lot of these medications out there can deplete our vitamin B12 level, which is really important for brain function and preventing the risk of Alzheimer's and dementia. And if you're not supplementing appropriately with B12 or getting B12 and B vitamins through your food, then that's a risk factor as well. I mean, eventually you're going to become more brain fog and start to have memory issues and go down that dementia, or I shouldn't say you can go down that path of dementia too. So like you said, it just really should be monitored appropriately. It should be used as an adjunct to what you're doing with a lifestyle change, and really seeing the right person to manage that from the inside and outside.
Yeah. And I think, Jenni, it really does come down to still that same bias, is that it's just, if people just eat less, that's all there is. That's the magic. Eat less. And it's like, so many of my patients over the years weren't eating very much at all, but they were just gaining a lot of fat.
Not eating enough.
Right.
We see that all the
not
time.
eating enough of the right things, not enough protein, and the difference that it makes with aging and with insulin resistance. And that's really the important thing of your message and your podcast, that you really try to get out there for people, not just chastising them that they eat too much and they eat poorly and all this other stuff. It's just, not giving our bodies what it needs. And it's probably more important in weight loss than anything, because the body is going through such change and it's breaking down tissues in the process of weight loss. If you don't give your body what it needs nutritionally, it will take it from the only place that protein exists in the body, which is in the muscle system. So your legs are less strong, arms are less strong, your core is less strong, but your heart is also muscle, so I am concerned of people maybe not fully understanding how these medicines need to be used with properly, with the right diet, to get the best results, and ones that will allow people to maintain weight lifelong. And I'm not necessarily convinced that somebody has to use these medicines forever.
Right.
If you are able to lose a substantial amount of weight and maintain your fat-free mass, your muscle mass in the process, you could get by without these medicines, I believe. Sure. Even though they're being marketed as you have to take them forever.
Well, once we can get the markers of insulin and blood sugar under control and keep it controlled with the proper diet and exercise, we should be able to maintain that theoretically. But like you've already said, we don't know, because there's not enough, we haven't had the medication around long enough to know and to be able to do the research on it. So
yes, but maybe these medicines help long enough for people to really create those good habits around their diet, around their lifestyle, around their exercise, and have that become, again, those mindless things that they do to take care of themselves on a regular basis. I think probably one of the best things that's come out of the use of these medicines is at least the understanding that we don't have to have a patient who's so successful losing weight, like 60 pounds, have to gain all the weight back before they're allowed to get treatment again. Right. That was just really a travesty that was played out over and over with regards to weight management. It was like as a personal failure. People were meant to feel like if they gained weight back after, being off of medication or whatever the regimen that they were on that helped them manage their weight. But really finding things that work with the body. I don't believe in starving the body. I believe that in order to, lose weight and keep it off, you want to maintain your muscle. You need to give your body adequate nutrients, but you do also need to move and get regular exercise consistently. It is something that has to be built into your life on a regular basis. And while those things may seem like, oh, everybody knows that, there's nothing new and sexy with that, that's really what makes the difference.
Right. What it comes down to. And staying consistent, disciplined, consistent, and accountable to yourself. Well, this has been wonderful. I bet we could talk for hours and hours, but I really appreciate your time and your willingness to come on the podcast and share your knowledge. Again, this is Dr. Carolyn Cederquist, a huge mentor of mine, and really was able to turn my life around. I give her a ton of credit for where I'm at today as far as helping clients, but also my own health. So thank you again for coming on. I really appreciate it. And we'd love to have you back in the future.
Oh, it's my pleasure, Jenny.
Very good. Well, thank you for tuning in to the Berman Method Podcast, where we are focused on treating problems and not symptoms. Be sure to subscribe on your favorite platform. Send us an email. Let us know if you have any comments, concerns, if you have any specific topics that you want to hear us discuss. And we will see you next week. Ciao for now. Thank you for subscribing on your social media and podcast platforms to the Berman Method. Dr. Jake Berman with Berman Physical Therapy and Jenni Berman, Physician Assistant with Berman Health and Wellness. You can find more information on our website, www.bermanpt.com for physical therapy, bermanpt.com/wellness for the health and wellness. You can also find us on social media, Facebook, Instagram, and on your podcast platform. So be sure to follow us, like us, subscribe to us. And if you would like any further information, definitely visit our website and reach out to us. You may also find our free reports on the websites as well, where you can download this free information for yourself. Have a great day.